Hey everyone, and welcome to a special video from the Blind Poet YouTube channel. So my name's Dave Steele, I'm known as the Blind Poet. For all of you that are new to the channel, if you like the content that you've seen in the previous videos and this one which I'm about to do, please don't forget to click the subscribe button on the channel and show your support for everything that I'm trying to do with raising awareness for people like myself with visual impairment and especially retinitis pigmentosa. So for those new to the channel, I am registered blind, I am a poet, I read and write poetry all about everything to do with day-to-day life, living with low vision or blindness. And today's video I want to do something a little bit different, a little bit special, because yesterday I went and had some surgery, I had a procedure, and I want to talk about that. So this video is all about having cataracts surgery with retinitis pigmentosa or another low vision form of low vision. Now, the reason why I wanted to do this video is when I had my cataract surgery initially, which was beginning of 2019, I wish someone had given me the information that I'm about to talk about right now. So, RP, retinitis pigmentosa. For those that don't know anything about it, I'll give you kind of a brief explanation of what it is and how I see. So retinitis pigmentosa is a hereditary eye condition or eye disease, which means it runs in the family. There are lots of different genetic mutations and types of RP, but generally the way that you lose your sight with RP is it will start off with night blindness, so struggling from light to dark places, not being able to see in low light situations, not being able to adjust to different types of light, and also being extremely sensitive to glare, so sunlight, bright lights, things like that. You then start to lose your peripheral vision, so they call it tunnel vision, so it's like a tunnel closing inwards, and then your central vision starts to go, and in a lot of cases it results in blindness. I was first diagnosed with RP just about 6.5 years ago. I am registered blind, or as it is known here in the UK, severely sight impaired. My left eye is my worst eye, and my right eye I've lost all my peripheral, but in my right eye I still have a good bit of central vision, which allows me to read text if it's big enough, see my wife and my children's faces, thank God, and still enjoy a lot of the beauty, all but through a very restricted tunnel view. Also, I think the best way to describe it would be like looking through a straw, which is the way I often describe it when I'm talking to people. So, about my journey with cataracts. So, I want you to imagine, for those people that aren't affected by low vision or RP, that you are, got this view of like seeing through a straw, and the central vision that I'm clinging onto is very precious to me. Now, a few years back, I developed small cataracts. Now, what is a cataract? It is a piece of kind of film, cloudy film over the lens of the eye, which obstructs vision. So when you've got no peripheral and the central vision you have is blocked by a cloudy piece of cataracts, it pretty much takes everything that you've got, as far as making everything blurry and also making you even more sensitive to sunlight and bright lights and glare and things like that, which can really make getting around very, very difficult, whether you were using a cane or a guide dog or not. It's still very tricky to do. So I first found out I had cataracts about 3 years ago. I went to a checkup and they told me that I had 2 small cataracts, but they were sat centrally in my eye. So although for a normal sighted person who had developed cataracts, having them quite small and sat centrally wouldn't be a major issue. For someone who's got very limited vision, when cataracts is sat quite small and centrally, it really does make a big impact, and it really did with me. I was really struggling to see. So, having consulted my doctor, my eye doctor, we both made the decision that they would refer me for cataract surgery to have my cataracts done. So this was about 2 or 3 years ago, as I said, when I was first, diagnosed with cataracts as well as my RP. So they referred me, said, look, there's a waiting list, you know, these things may take a while. So, you know, it's not going to be something that'll be done quite quickly. So just try and get on with things as best as you can. So I did. And about a year passed and I'd heard nothing. And at the beginning of 2019, my wife Amy said to me, you know, you've not heard anything for a while. I know they said it'd be a while, but you should really chase it up. So I contacted my doctors and they looked into it and said, oh, apologies, the referral letter had been lost, and we will get it sent straight away, and hopefully you'll hear something pretty quickly. Literally within a week of that phone call, I got a letter through saying that they would like to see me at the local eye hospital for an assessment to see about the cataract surgery and to talk it over with me with a specialist. And I went there a few days later to the appointment, and when I got there, they checked me out and they said, look, we would like to get the left eye done first of all because that's the worst eye of the two. And actually, we've got a cancellation for early tomorrow morning to have the surgery. We know it's a bit short notice. It is completely up to you. But if you feel you would like to do that, then there's a slot there that you can take and you can get your cataracts in your left eye done the following morning. And I immediately said yes, but at the same time was very nervous about it because I don't know about you guys, but the thought of anyone putting a needle near my eye or an injection in my eyeball, oh God, it just made me absolutely cringe, and it was really quite a scary thing. So I was very nervous about going, but I tried to, you know, as I always do, not let the nerves get the better of me, and I went along to that appointment in the morning with all the hope in the world that everything would go well and it would be okay. I went to the surgery and I've got to tell you, the surgery was an absolute breeze. Having an injection in the eyeball was nothing like I experienced. First of all, you're given drops called dilating drops to open up the eye so they can see right into the back, which normally take about 10 minutes to kick in. I'm used to having dilating drops. I have them pretty much every time I go for a checkup with my eyes now due to my RP. And then they gave me these numbing drops, which were basically anesthetic drops in my eyeball, which basically numbed up the whole area. You literally, like to my cheek, I couldn't feel. It was like going to the dentist, that kind of numbness you get in your mouth, but the whole area there was completely numb. And then they obviously took me in for surgery. I was awake while the surgery was going on, felt okay, couldn't feel anything, just lots of bright light, lots of fluid and water while they were doing the surgery, and then a bit of pressure, like pushing down, but no pain whatsoever. And within about 20 minutes, the surgery was done. I had an eye patch on and I was on my way home, and all was good. So being quite prevalent on social media, I'd posted that I was going for surgery. A lot of people who follow me knew about it, and I started to get messages. I even did a video, I think, for Facebook with the eye patch on, just back and, you know, waiting to recover. And everyone was sending me messages saying, you know, how are you? Are you noticing any difference yet? How, you know, have you noticed in bright colours and lots of clearer vision? And as the recovery days kind of rolled and went on, I remember feeling like I wasn't seeing any benefit to the surgery whatsoever. Now, as I tell this story, I want to point out this is my experience. I know lots of people that have had cataract surgery and it has been tremendous and brilliant for them. People with RP are also included in that, but I want to make this very clear. There is a higher risk of things not working out the way you hoped they would when you have a condition like RP. Now, let me explain a little bit more. Retinitis pigmentosa, as I've just said, is a retinal disease. So the retina is the thing that sits at the back of the eye, which interprets what the eye is seeing and sends that signal to the brain. Now, my retinas, due to retinitis pigmentosa, have pigmentation all over the back of them. They are deteriorated to the point where they are hardly any use anymore. So the eyes are very reliant on the retinas. Now, when you have cataract surgery, hopefully, you know, for most people, it will make things a lot clearer, a lot sharper, that blurriness will go and everything else. But because the retinas are dying in the back of my eyes, and on top of that with the cataract surgery, people with RP are more prone to developing something called cystoid macular edema. Okay, cystoid macular edema. Now, I've had cystoid macular edema before. I had a very slight case of it when I was first diagnosed with RP, and people who have cataract surgery are prone to it, but people with RP are prone to it as well. Now, what cystoid macular edema is, it's basically when you have cataract surgery or retina is deteriorating at the back of the eye. It creates sometimes little pockets of fluid in the back of the eyeball. And those little pockets of fluid cause extreme sensitivity to sunlight and blurriness in vision. Now, for someone that already has those things, that extreme sensitivity to sunlight and the blurriness, now these things are caused by RP, but they're also, caused even more by cataracts. And then you get cystoid macular edema on top of that. It takes it to a whole new level of blurriness and a whole new level of sensitivity to light. And lo and behold, I found out at my next checkup when I went for a follow-up that I'd actually developed cystoid macular edema. And I was prescribed 2 lots of eye drops that I had to take like 5 times a day. There's a few side effects with the eye drops as well. They don't make you feel too great. And I was on them for the foreseeable. So I went for the cataract surgery hoping that my vision was going to get sharper, but it actually didn't. My vision got worse because of the cystoid macular edema, which was a risk. Now, this is something that I wish people or a physician or an eye doctor would have discussed with me in more detail before I'd had the surgery, because I maybe would have thought twice about it. So I continued on with the drops. They advised me not to get the right eye done because with the right eye being my good eye, if I was to risk getting cystoid macular edema in the right eye, that would take my remaining vision for the foreseeable while I'd be on drops for both eyes, and it would make mobility and quality of life even worse. So I decided not to get the right eye done, continued with the drops in the left eye, felt my vision, no change in my vision whatsoever. It was just that it wasn't getting any better. About 6 months later, I went for another follow-up, and then they said that the cystoid macular edema looked like it was clearing up, but I then developed something called PCO, which is posterior capsule opacification, I think. I may not have got the term there right. Apologies, I'm not a doctor. Which basically is deposits. What happens is when they do cataract surgery, they take out the natural lens of the eye and replace it with an artificial lens. And sometimes when they put that artificial lens in, little bits, little fragments from where they've done the cataract surgery can sometimes remain and get stuck onto the lens that they've put in, the artificial lens in the eye. And that then causes extreme blurriness and extreme sensitivity to light. So not only did I have cystoid macular edema, but I also had PCO as well, which was making the light so bad that I couldn't go outside without very dark sunglasses. Some days when it was bright, especially this time of the year, in the winter time when the sun is sat very low in the sky, it was really, really painful. So often I'd feel the glare just sat here in my living room. I'd sit often with the blinds closed and really felt like I was even more isolated because of my vision than I normally am. So that has been pretty much where I've been for the last kind of 3 or 4 months now. Staying in a lot, obviously I'm doing that anyway due to the pandemic, but due to the PCO and my cystoid macular edema, my eyes just really couldn't take any kind of light, which was really making me struggle. Not just physically, but emotionally with anxiety and depression and things like that. I was told that the PCO can be treated. You can have laser treatment, which is only a 20-minute procedure. It doesn't take long at all. And in a lot of cases, and most cases, it's really, really successful, pain-free. You don't need any anesthetic or anything like that. It's really, really easy to do. But due to the pandemic, there was a waiting list and I'd have to be referred for it. My Christmas was made about a week ago. I got a phone call last Friday. It's now, well, in fact, a week today, actually. I got a phone call saying, we've got an appointment if you'd like to take it for Thursday and 6:20, which was last night. You can go and get the procedure done, and hopefully that will make a bit of difference to your vision. So I went and got the procedure done last night. Very, very simple. We were in and out there really, really quickly. Had the dilating drops, had some numbing drops, and sat in front of the machine for a few minutes while they did the laser treatment. Looked into a light. The laser went into my eye. I heard a very strange kind of clicking noise inside my head when he was firing the laser, which was really weird, but completely pain-free, just a bit bizarre. And then that was it. It was done. I waited for the drops to wear off, which they did late last night. And I got to say, I am seeing so clearly. I can't remember the last time I saw this clearly. I've had this kind of like swelling in my eye for the past God knows how many months, which almost feels like you've got a bit of grit or something in your eye, but you just can't get it out, and your eyeball feels swollen. And I felt that way, and it's been really annoying. At times I've wanted to like tear my eye out because it's been so frustrating. But that's gone, and I can see colours. I can deal with brightness. I can look, outside in the light. I can look at this ring light and it doesn't hurt that much. And it's a real difference. So finally, after all this kind of to-ing and fro-ing and the complications, my vision is a lot better in my left eye. Literally yesterday when I went into the appointment, when they checked my left eye, when they covered my left eye, I only had light perception, so if you were to wave a hand in front of my eye, I couldn't even see the movement. Now when I cover my right eye, I can see my face in the screen, not very detailed because of my RP, but I can see, myself, I can see the window behind, I can see the Christmas tree here, and I can see clearly. When I have both eyes open, and the right one is compensating for the left, I can see much clearer than I did. I can see my wife's face in much more detail. I can see colours, and I'm going to enjoy this clear vision that I have, which is not perfect vision because of my RP, but a lot better than I've had for a long time now. I'm going to enjoy that and looking forward to Christmas. So I just wanted to come on and give a little kind of explanation of the journey. I once again want to say I wouldn't let it put anyone off getting cataract surgery because, most cases it's successful and you see clearer. But I do want to know, people to know that when you have RP, that there is a higher chance of you getting cystoid macular edema. So you may want to ask questions about that, and also ask about PCO as well, which I still can't pronounce. But there we go. So I just want to say Happy Hanukkah to all my Jewish friends. Happy holidays to everyone, and a Merry Christmas. And I'll be back with some more videos from the Blind Poet channel very soon. Thanks. For myself, Dave Steele, Blind Poet. Take care.